So if you're watching this video, you have just gotten an implant placed, and I want to go over how to care for that and the things to watch out for. So it's very normal to have tenderness in the area where the implant was placed for up to a week. You likely have a couple sutures in there that we will have you return to the office. We'll remove those sutures and we'll check on the healing. That tenderness that you're experiencing, that typically is something that can be managed at the most with a little bit of ibuprofen and maybe even a little bit of Tylenol. Most of my patients will do 2 ibuprofen and 1 Tylenol for the first couple days, every 4 to 6 hours, and that's typically enough. It shouldn't be excessive pain. If you have any excessive pain or any type of throbbing pain, you're gonna wanna give me a call and come back in and see me. You may have a silver cap in the area where the implant was placed. You'll feel that with your tongue, but not always. I don't always place that. So if you do feel that silver cap, you know what that is. As far as care goes, I'm gonna want you to eat soft foods for the first 2 to 3 days. Really soft foods like puddings, yogurts, soups, protein drinks, scrambled eggs, that type of thing. If I prescribed you antibiotics for your implant, I'm gonna want you to take that for the full duration of the prescription. Typically it's 7 to 10 days. When you get home, if you're worried about swelling, you can take a pack of peas or a bag of ice and put it on that area. You don't want to leave it there for more than 20 minutes though. So you can do 20 minutes on, 20 minutes off. And I would wrap that in some sort of towel or cloth so it's not too cold to your skin. A little bit of swelling is normal. If you have a lot of swelling or if you feel like you have an infection, please give me a call and come see me as soon as possible. So in that first 2 to 3 days, I'm going to want you to limit your activity. No strenuous activities. I don't want you to work out. I don't want you to go for a run, anything like that, okay? You also may experience a little bit of bleeding for the first 5 to 6 hours. If it's bleeding to any excessive amount beyond 12 hours or the first day, please give me a call. If you are a smoker, it's also very important that you refrain from smoking at least until the gums are entirely healed. Smoking is one of the main causes for implant failure, so you want to be very careful with that. So right now the implant is in place. We won't be restoring that implant until it's fully healed in the bone, and that's going to be 3.5 to 4 months later. So if you haven't already made that appointment, feel free to give us a call at that point to come back in and get the implant restored so you can get that crown. If you have any other questions, feel free to give us a call. Thanks.